Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Hope you're doing well wherever you are and however you may be listening on whatever platform you might be listening to us on today. Hope everything's going well. Thank you so much for tuning in. This is the Everything Medicare Podcast, where I'm your host, Christian Brindle, where every single week we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. If you're not familiar with my work, folks, or what my company does, I actually own an agency just outside of Salt Lake City, Utah, called Christian Brindle Insurance Services. We work with people all over the place on their Medicare health plans, specifically in 5 states, Utah, Florida, Texas, Idaho, and Oregon, and we're always adding more states to that. And I've always found it kind of funny, folks. Today, particularly, we had a couple of people contact us, due to the podcast. But last Friday, we had a couple people as well contact us. And on Fridays, our office staff typically isn't here. Just me and maybe some of the other agents that work that are here. But my assistant isn't here on Friday. Our office manager is not here on Friday. And typically, though, our staff are the ones that typically answer the phones. And people always contact us and reach out to us because they hear the podcast, they kind of like the idea of us providing information to them in a way that they can understand. The podcast is a great way for people to feel us out if they do want to work with us, because it kind of gives them an idea on kind of a vibe of me and our organization and kind of what information we can provide. And it turns out to be really beneficial for them. But people end up reaching out to us, and people on Fridays, like I said, office staff isn't here. So typically I'm here, some of the other agents are here, but that's about it. And a couple people contact us on Friday, and they every time someone contacts us on a Friday and I pick up the phone myself, they seem very perplexed. They're like, "Oh my gosh, he answered the phone." And just wanted to let you know, folks, if you ever call on a Friday, you'll probably either get me or one of the other agents here. Okay? But if you call throughout the week, you'll be able to talk to our staff. But it doesn't mean that we're not going to answer the phone if the staff isn't here. Okay? I always pick up the phone if I'm able to, if no one else is here to do so. Okay? I'm not above that by any means. I mean, I'm here to help. I'm here to work. Put me to work. That's what I'm here for, folks. Today, we're going to go over the official numbers of the Medicare Part B premiums and Medicare Part B deductibles for 2020. A couple of weeks ago, folks, I did an episode where we did the projections. Okay, the projections had come out from Medicare, the Centers for Medicare and Medicaid Services. Had came out with some projections on what they believe they might turn out to be, but nothing was official. Today we're going to do an episode telling you what the official projections of those are going to be. But before I jump into that, I wanted to just give you a quick reminder of something that can be incredibly helpful to you with your Medicare Part B premium. Unless you have Medicaid, you are paying the Part B premium if you have Medicare. I run into people constantly, and I thought it was something that would be helpful to be addressed. I run into people constantly, folks, that don't think they're paying the Part B premium because it's coming out of their Social Security check every month, like clockwork. It doesn't even show up on a statement. It's just money that they're not getting back, which in my book is still a payment. So just keep in mind, if money is coming out of your Social Security check every month for and it might not be to your knowledge, but if you have Medicare, Part A and Part B, you are paying for it unless you have something like Medicaid or something else that along those lines that helps pay for it for you. Now, in some areas of the country, there are Medicare Advantage plans that have Medicare Part B givebacks that help reimburse a portion, if not a good amount, of someone's Medicare Part B premium. So there's an exception as well. But I run into people all the time that don't have Medicaid, that don't have a Part B Give-Back Advantage plan, and they say, well, Christian, I'm not paying anything. They don't realize it's coming out of their Social Security check, okay? So this does impact you. The Medicare Part B premium does impact you, okay? You have to be aware of that. Stay with me, folks, into segment 2. I'll be back where, after a quick word from this week's sponsor, and I'll go over exactly what those numbers are going to be going into next year. We have an exact amount now. Don't go anywhere. I'll be right back after a quick word from this week's sponsor. We'll take a quick break. Stay with me. Welcome back, everybody. Thank you for sticking with me into segment 2 of this episode of the Everything Medicare Podcast. This episode is going to be shorter than normal. There's not a whole lot to tell here, but we do need to talk about these Medicare Part B premiums and also the Medicare Part B deductible. Now, we had some projections, okay? I think the projections said that the Medicare Part B premium would be about $146, okay? And we had some projections that said that the Medicare Part B deductible was going to be about $196, okay? If my memory serves me correctly, those are kind of the numbers we were expecting. The numbers are not too far off from that, okay? The Medicare Part B premium in 2020 will be $144.60 a month. If you're in a higher tax bracket, obviously that's going to be more. We've done episodes about that in the past. And obviously if you have Medicaid and it's paid for on your behalf, that obviously will not impact you either. But for everybody else, the Medicare Part B premium will be $144.60 a month. This year in 2019, it was $135.50 a month. Okay, so it's going up a little bit. Keep in mind this, okay? Factor it in. If you notice that your Social Security checks have a little bit less in it than normal, that would probably be why. The Medicare Part B deductible was $185 in 2019. It will be $198 next year. Okay. $198. So it's right around where we were expecting from the projections, but it's a little different, and I wanted to do an episode and address it. My thoughts on it, folks, are quite simple. I mean, do I like that the premiums and the deductible go up on these things? And let me first preface my comments by saying if this is your first time listening and you're wondering what the Medicare Part B deductible is, it only impacts you if you have a Medicare supplement plan or if you just have original Medicare. The Medicare Part B deductible does not mean anything to you if you have a Medicare Advantage plan. Let me preface my comments by saying that. The Medicare Part B deductible is a small one-time-a-year fee that for several different claims, I would say, that can be billed to Medicare that could trigger this Medicare Part B deductible. And there's several Medicare supplement policies that don't cover this Medicare Part B deductible, such as a Plan G, a Plan N, and et cetera, a Plan D. And because of this, we see this being impactful for people, you know. Now, if you have a Plan F, and a Plan F pays the Medicare Part B deductible, does that impact you? Well, not directly, because you're in a situation where the Medicare Part B deductible is paid for by your plan, but typically they will factor that into your rate increases. If they have to pay more for the Part B deductible on a mass scale for every single policyholder they have on a Plan F, this insurance company I'm meaning, they will factor that into your rate increases going forward. So it impacts you whether the plan pays the deductible or not. It doesn't impact you if you have a Medicare Advantage plan. So let me preface my comments by saying that. But do I like to see these Medicare deductibles go up? Do I like to see the premium go up, even if it is just by a little bit? No, I don't. Of course not. But I'm a realist. I understand that it's a situation where everything goes up in price. Cost of living, healthcare, price of food. I mean, we've all heard that story, you know, where, you know, a grandparent talks to their grandchild and they said, oh, in my day, a loaf of bread was a nickel, or whatever, you know, the case was with that. And the child says, wow, really? It's $5 today. $3 or $4 today, depending on where you might go to the market, everything goes up in price. A lot of that has to do with inflation. Those of you who don't know about inflation, inflation was put into term by the government because we were taken off of the gold standard. Once upon a time, folks, and most of you listening probably already know this, but our dollars meant something. Our dollar bills were backed by gold and silver. And a dollar bill was actually a silver certificate, representing an actual piece of precious metal. Dollar bills were not just paper back then. We were taken off of the gold standard, and the dollar bill no longer meant anything. So now the dollar bill's value is based on how many dollar bills are floating around. Every time the government prints more money, the value of all of our dollars go down. Because anytime there's more of something available, it becomes what? Less valuable. A collector's item is only a collector's item because there's not that many available. But if there's unlimited amounts of that collector's item available, is it worth anything? No! It's all based on what's available and what's not available. The dollar bill is no different. So anytime the government prints more money, all of our dollar bills and all of our money becomes less valuable. And because of inflation, our dollar is always consistently going down in value. And that's more of a economical issue than a Medicare issue, but it impacts everything. Healthcare included. Premiums included. So it's a difficult situation. I completely understand that. I know a lot of people listening to this podcast are on a budget, but it's not something that anything can be done about it unless something is done about how our economy works in this country. And I don't have the answers for, the inflation issue. Nobody quite does. I mean, you can put your money in a high-interest savings account, earn 1.5% to 2% interest, instead of just keeping it in the bank. There's an option. That way, your savings earns more money back in interest, and you can kind of beat inflation. Or you could put your money in, something like an annuity or a mutual fund or something like that that's going to earn a little bit more interest if you do have savings available to do so. That's kind of the only way you can combat inflation. But I wanted to put that into perspective because everything goes up in price. Gas, food, cost of living. It's an unfortunate fact of life because we were taken off of the gold standard once upon a time. Let's take a break, folks. I have some final thoughts I'd like to share with you on this topic. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks for sticking with me all the way to the end of this episode of the Everything Medicare Podcast. And folks, I wanted to take a minute and say thank you to everyone that's been listening since the beginning. By this time, we have eclipsed over 20,000 downloads on this podcast on the various platforms that play the audio, whether that be probably our biggest platform is Apple Podcast. But that would be Apple Podcasts, Google Cast, Castbox, Stitcher, iHeartRadio, Pandora, Anchor, Spotify. I could go on and on and on. We're on a lot of platforms. That doesn't include YouTube views. I'm sure there's another couple thousand on there at least. But we've eclipsed over 20,000 on the audio portion of this podcast, and I very much am appreciative of every single person listening for that. Once we hit 100,000, I have a special surprise and basically giveaway to the audience at that point. So stay tuned for that. Keep listening. We'll get to 100,000 plays in no time. We got from 10,000 to 20,000 much quicker than we did to 0 to 10,000. Okay, so thank you so much to everyone for your support. Thank you to everyone in the audience who is a client and a customer of ours. We really appreciate your business, but if you're not a client of ours, I really appreciate your listenership. I hope that this podcast is helping you in your day-to-day life navigating your Medicare in a world where Medicare information is scarce, We want to be that ray of hope to where it's basically unbiased information that can help you out. There's a lot of people in the insurance industry that don't like what I have to say, and I've said this before, and it's not really, I don't necessarily think it's just me crying about it. But there's a lot of people in the insurance industry that don't like what I have to say because I expose them, and they like to bash me for it, but that's never going to stop what we do here. We're gonna rip the blanket off, if you will, and kind of expose everything. Rip the sheet off and expose everything that goes on in this industry, so that way you are empowered. You're empowered to make good decisions and understand what your choices are. You're only in a bad situation when the insurance company and the insurance industry has all the knowledge and they just tell you what they want you to know. That's bogus. I think it's sick. And we're going to continue putting the power in your hands, the consumers, the customers, the people that actually are on the policies. As always, folks, we still have a little bit more time in the Medicare enrollment period. As I mentioned at the beginning of the episode, we work with people in Florida, Utah, Idaho, Oregon, and Texas. Again, that's Utah, Florida, Idaho, Oregon, and Texas. If you'd like to have your plan compared, no cost, no obligation, my office number is 801-255-5340, 801-255-5340, or you can shoot me an email at christianb@xmission.com. Christian, Christian, B as in boy, at xmission.com. If you'd rather communicate with me that way, no cost, no obligation. If we take a look at your plan and we find out that you're on the best available thing for you, we're going to be in a situation where we're obliged to tell you that. We work with all of the largest insurance companies in the industry. We work with so many companies I can't even count them at this point. And that's what we do here. Medicare is what we do. It's our specialty. I've written 2 books on the topic, and we'd love the opportunity to be able to help you. Remember, December 7th is the cutoff date. December 7th is the deadline. We'd love to put you in a position where you can save money or improve your coverage if it's available. Thank you so much, folks. Thanks for listening. We'll be back with you on our next episode. Have a great day.